Chronic disease. Did you have any chronic disease? Again, first of all, avoid the word diseases, not nice. Illnesses, not nice. Conditions. Yeah. Again, avoid the word chronic. Do you think the patient will understand chronic? No, don't use such a word with which you think the patient will not understand. Long term. What is the short term? You don't want to know. What do you mean long term? Give me an example. Diabetes, high blood pressure. What if we had an MI 5 years ago? Don't you want to know that? Is that a long term problem? No. So this is a wrong way of asking questions. Have you been diagnosed with any medical condition before? Have you been diagnosed with any medical conditions before? You should use the right words. Your wordings are not right, then they don't give you a proper history. Because last time also somebody asked, do you have any significant medical illnesses? Do you think the patient will know which is significant, which is not significant? This is a wrong way of asking questions. Okay, so imagine you ask the patient, you have any medical conditions at all? Have you been diagnosed with any medical conditions? He may say, yes, doctor, I got diabetes. What do you do now? Then you explore a little bit about it. Okay, so what about diabetes? Is it diet control, or do you take medicines? If it is, which medicine? How long? And what is the most important question about diabetes? Is it controlled? Is it controlled well or not? Okay, that means if he names any medical condition, explore that condition little bit, only if it is necessary. If it is not necessary, that particular station, don't keep wasting your time exploring the condition. If you think it's relevant in that particular station to explore the condition, then only explore, otherwise do not. Okay, so sometimes he will say, yes, doctor, I got this condition. If you think, explore. If you think it's necessary, explore. But what will you do? Imagine you ask a patient, you have a medical condition at all. He says no. What do you do now? Then you ask separately. Why?
To make sure.
Make sure. If you ask him, have you been diagnosed with a medical condition? If he says no, that means he should not have any medical condition. Sometimes he may have a medical condition. For example, imagining he has got high blood pressure and he's taking medications for that, and the blood pressure is controlled now. For him, it's not a medical condition anymore because the blood pressure is controlled. So he may not mention that to you. Or he had some medical conditions in the past and he forgot about it. So he may say no. Or he may have some medical condition which he thinks that is not that important to tell the doctor. That means if the patient tells you, when you ask a question, you have a medical condition, if he says no, it does not mean that he has no medical conditions. So what do you do then? Then you name the relevant medical condition and ask. Name the relevant one. Relevant, not relevant one. Name the relevant medical condition, ask, do you have this, do you have that, do you have that? For example, imagine 50-year-old man got a chest pain. I want one of you to take past history. Take past history. Mr. Smith, 50-year-old man, chest pain. Past history only, not present history. You got severe central chest pain, okay? You finish the present history, is all done. I just want to start with the past history.
Okay, hello, Mr. Smith.
Hello is done. If you already taken a present history, hello is done, isn't it already?
All right. Have you been diagnosed with any medical?
What is the first question in the past history? Did you have similar problems in the past? No, doctor.
Have you been diagnosed with any medical in the past?
No, doctor.
Do you ever have high blood pressure?
No.
Diabetes?
No.
High cholesterol levels?
No.
Do you smoke?
Well, past in our smoking and all comes later in our format. Medical condition. Smoking, is it a medical condition?
No.
No.
I thought maybe you used to smoke and then you quit. That would be relevant.
Is that a medical condition?
No.
No.
I don't know.
You will not ask the most important question in the past history. Yeah, he asked about the diabetes, high blood pressure, cholesterol. Are they relevant?
Yes.
Yes, they are relevant. But the most important one you not asked me as yet. He had a chest pain.
Heart condition.
Do you think you need to ask that question? Did you have any heart conditions in the past?
Yes.
Yes. No. One more. In the chest, you have only heart, or do you have anything else in the chest? Lung. Which one? Which condition in the lung you would like to name it and ask? The most important condition in the lung. If you had a chest pain, remember chest pain? Pulmonary embolism. How do you ask?
Did you ever have a pulmonary embolism?
Embolism, yeah. You think the patient will understand? Did they have any blood clots in the lungs or legs before? So these are the relevant one you should ask. Okay, so at least some important ones. Sorry. So first you ask, do you have any medical conditions? He says no. Then you don't stop there. Then you name relevant condition. You have been diagnosed with high blood pressure. Do you say hypertension or high blood pressure? High blood pressure. Don't say hypertension. Okay, then the patient says what? Okay, high blood pressure. Diabetes. Do you say diabetes or high blood sugar? Diabetes. People know diabetes more than high blood sugar. Okay, so you should ask diabetes. And have you checked your cholesterol before at all? Have you had any condition heart before? Did you ever had any blood clots in lungs, legs before? This is important medical condition. You must name it and ask. Do you want to ask him, did you have any jaundice before? Why not? It's not relevant because he's got a symptom at the moment is chest pain. So jaundice and chest pain not relevant. So don't ask such things which is irrelevant. Only the relevant conditions. Okay, let me give another example. Imagine there's a 50-year-old man came with history of collapse. History of collapse. What is collapse? Loss of consciousness for short time. Means he is conscious now. Okay, there was a period where he lost consciousness. Now he's conscious. So you're taking history. Now you finished taking present history, past history. I want one of you to ask me only the past history. Who won't ask me? Who won't ask me? Past history only. Yes, doctor, ask me. Past history. Mr. Smith, 50-year-old man.
Mr. Smith, have you had similar problems in the past?
No.
Mr. Smith, have you had, do you have any history of high blood pressure?
No history. Don't use the word history.
How about diabetes?
Do you have any medical? What did I say? So first you ask your open question. What is the open question? I have been diagnosed in medical condition. Don't straight away ask, do you have high blood pressure? Do you have these things? Then what will happen? He must miss some medical condition, what he has got. Can you name in each and every medical condition? No. First ask open question. Do you have been diagnosed with any medical conditions at all? No. Now you start asking. Now name the relevant conditions.
Have you had high blood pressure in the past?
No. In the past? Is it in the past? High blood pressure, is it in the past? No. Do you have high blood pressure? No.
Do you have diabetes?
No.
Do you have any problems with your cholesterol levels?
No.
And do you have any history of epilepsy?
No.
Do you have any history of fainting attacks?
No.
Do you have any history of...
I don't know why you keep using this word history. I told you no history, no geography, no, we don't want all that. They have this problem before. You remove that word history.
Stroke before?
No. One more important condition. They are telling you, prompting you.
Have you had trauma?
Say there's something before that.
Have you had any heart condition before?
No. Do you think that's important? Heart condition? Yes, good. Fine. Now you ask all the relevant ones. You named high blood pressure. Is it relevant? He had a collapse, remember. High blood pressure is important. Diabetes is important. Diabetes people can collapse. Okay. Heart conditions, very important. Okay. Epilepsy. Have you been diagnosed with epilepsy at all before? No. Okay. These are very, very important conditions. And stroke, you ask. Good. So heart conditions. And most of the important conditions named and asked. So that means these are the relevant conditions. You must name it and ask. Even when you ask a patient, you have a medical, if he says no, you don't stop there. The relevant condition, you must name and ask. So all of you know how to take past history now. One more important question in past history. Have you ever had any surgeries before? Have you ever had any surgeries before? There was a lady, 45-year lady. She's got a pain abdomen here. 45 lady, pain abdomen here. Comes and goes, pain comes and goes, comes and goes. Diagnosis. No fever. Biliary colic. Gallstones, you mean? Gallstones? Yeah, people said gallstones. Why gallstones? I said 45-year-old lady. Pain comes and goes. Right? Why did you say gallstone? Female, fertile, 40s. Yeah, what is that? Fair. That's why you said gallstones. Yeah. No, people fail because she did not have a gallbladder. Why? What happened to gallbladder? It was removed. So that means what is the most important question people missed? Past history surgery. Is it important? Never ever miss these questions in the past history, past medical conditions, past surgeries. Okay, so now we know what are the questions you need to ask in the past history. Next is personal history. Personal history. The personal history is something personal for the patients, like smoking, alcohol, recreational drugs, sexual history. There are so many other things, but these are the important things. Yeah, so now previously we used to say these are personal history, but now the GMC says there's nothing like a personal to the patients, because these are not personal to patients when they're talking to a doctor. Okay, because even a patient knows that these are very important and the doctor should know. So there's nothing like personal anymore. Now all these questions, personal questions, now it has gone under social history. Okay, all these personal questions, smoking, alcohol, are under social history. But I'm still keeping it as personal history. This is for the exam's sake. Because the third P, if you put everything under social history in the exam, sometimes you may not reach all the way up to social history. And most of these personal questions are very important in most of the stations. So that's the reason I'm still keeping under personal history, so that it will come as a third P. Okay, this is only for the exam. The minute you pass the PLAB exam, forget about a personal history. There's nothing called as personal history anymore. Okay, that's only for the PLAB exam. Okay, so now again, in the exam, don't ever tell the patient, can I ask you your personal questions, please? So as I told you, don't use this, don't signpost like, can I ask you about the first person, something personal, because there's nothing personal at all. So if you want to signpost these questions, how do you like to signpost? Lifestyle. Can I ask you questions about your lifestyle, please? Yeah, can I ask you can I ask you about your lifestyles? It is not really necessary, but if you want, you can do that. So then ask about smoking. Now, I want one of you to ask me about smoking. Imagine this is a 50-year-old man. 50-year-old man had got hemoptysis. Do you want to ask about smoking? Yes or no? If you don't ask, can you pass this issue? No. No. Any lung problem, if you don't ask smoking, do not expect to pass. Very, very important question. Now, I want one of you to ask me about smoking. Who's going to ask me smoking? Ask me. Mr. Smith, yeah. 50-year-old man. He got hemoptysis. Ask me about smoking.
Mr. Smith, do you smoke?
No.
Have you ever been smoked before?
No, doctor. Is it important question?
Yes.
Very important question. Because he may say, do you smoke? He may say no. Why? I didn't smoke for the last 2 days. But before that, he smoked for 30 years. So that's very, very important question. Have you smoked before? Oh, good, fine. So he may say, yes, doctor, I smoked before. Yeah. Then you ask, okay, what do you smoke? How much? How long? But last time somebody asked me, do you smoke cigarettes? I said no. Did you smoke cigarette before? I said no. Why? He was smoking cigars. That means there's a wrong way of taking history. So don't ask a patient, do you smoke cigarettes? So how do you ask this question? Do you smoke? Yeah, don't add cigars, cigarettes, nothing. Okay, do you smoke? If he says yes, then you ask what? What do you smoke? How much you smoke? How long you smoke? How long you been smoking? But other important question, if he says no, the important question is, have you smoked before? Never forget that. So that's about smoking. And next is alcohol. Imagine the question says, this is Mr. Smith, a 50-year-old man. He had pain abdomen and a consultant did a gastroscopy which revealed gastric erosions. And the consultant thinks it is because of his alcohol drinking habits. You take alcohol history. How can you answer the question? The man had a pain abdomen, the consultant did a gastroscopy and he found gastric erosion, and the consultant thinks it is because of alcohol drinking habits. Okay, and you take alcohol history. That's a question. I want one of you to ask me about take alcohol history. Yes, doctor, ask me. I'm Mr. Smith, 50-year-old man. Yes.
Mr. Smith,
Yes.
do you drink alcohol?
No, doctor.
Have you had alcohol before?
No.
As you know, we have done a gastroscopy. As you know, our consultants did a gastroscopy, and we found a few findings on it, and they are quite suggestive of a person. It looks like something. It's quite suggestive of a person drinking alcohol. So I just wanted to confirm with you that you do not drink.
No, I don't drink alcohol. Oh, you're smiling. You don't trust me? Do I drink alcohol? Do I drink alcohol? Yes or no?
Yes.
Look at my face and tell. Do I look alcohol? Do I drink alcohol? Yes or no?
I don't know.
What are the questions say?
Yes, gastric erosion.
Gastric erosion. The consultant thinks it is because of alcohol drinking habits. Do I drink alcohol?
Yes.
Yes. Then why did I say no? Lying. Why?
People don't want to show.
He doesn't want to admit. Because why? He doesn't want to admit.
Social embarrassment.
Because he thinks, yeah, you're the doctor. So if I tell you, you're the doctor. Okay, if I tell you that I drink alcohol, you might tell somebody that I don't want that person to know. And who is that person? Wife. He doesn't want the wife to know about it. And he is a GP, he may be the doctor of the wife also. Yeah, imagine the next time wife goes in, how is your husband? Is he still drinking alcohol? What? This is the problem. So he's not trusting you. Sir, tell me, what are you going to do?
I can ensure you, Mr. Smith, that what is spoken right now will remain confidential within the medical team, and it will not be discussed with any other person other than the medical team, of course. So I ask you then if you do you drink?
Yes. You understand? Sometimes you'll have to offer the confidentiality. Because Mr. Smith, whatever you're going to say here will remain confidential within our medical team. You don't need to be worried about it. So could you please tell me, do you drink alcohol? Okay, then they say, yes, doctor. Most of the time in the exam, you don't have to offer confidentiality. So they will admit it straight away. But if they don't admit, and if you have a strong belief that they are drinking alcohol, then you offer confidentiality, then you say, then you try again. And there is a question in the exam. This is the new exam question itself. There's a lady is about say 45 something. She had an hysteroscopy. And the nurse noticed that she's got a bad drinking alcohol drinking habits. She got a bad alcohol drinking habits. She got this habit, and she has told you, and you talk to this lady. That is a question. You understand the question?
Yeah.
45 lady had a hysteroscopy, and the nurse in the ward, she noticed that this lady has got a drinking habits, alcohol drinking habits. You talk to this lady. Okay, so what are you gonna do? I would like to start this station. Imagine her name is Mrs. Anderson. How do you like to start? Okay, talk to me. I'm the lady.
Okay, do I start from the?
I told you the question. Start from the beginning.
Okay. Good afternoon, Mrs. Anderson.
Good afternoon.
I'm Dr. Okwe, one of the junior doctors in the department. I would like to. Okay. How are you today?
Oh, I'm fine, doctor.
Okay.
And you, doctor?
I'm fine too. Thank you very much. How did the procedure go?
Procedure? Oh, that's okay. They told me it's fine. Yes.
Okay, and you're not in pain?
No, doctor.
Okay. I'd like to talk to you about something the nurse noticed while she was attending to you. Okay. She noticed that you have a drinking problem. Is that true? She raised some concerns that you may have a drinking problem. I just want to confirm that. Do you take alcohol?
Alcohol? No, doctor. I don't know what the nurse was talking about. No.
Okay. Have you ever taken alcohol before?
Doctor, no, doctor. Never drank alcohol in my life.
Okay, Mrs. Anderson, I just want to assure you that anything you tell me here is between myself and the medical team, and that it's highly confidential. We won't have to divulge it to any other person. So I will ask you again, please, do you take alcohol?
No, doctor.
Okay, I just want to reassure you again. I don't know.
Is she drinking alcohol? Yes or no? Yes. That is the question. So she's still, even after gone, she's not agreeing. She's not admitting. What are you going to do? The first thing is, don't go to the alcohol straight away like that. One thing you did good, you didn't ask her alcohol. You talked about the hysteroscopy, had a procedure. How was that procedure? Anything wrong? Everything okay now? Are you in pain? You started off very well. You didn't go to the alcohol straight away. But even then, after that, immediately after that, you said, my nurse, concerned something about, she's concerned about your alcohol drinking habit. I would like to confirm. So that is also almost it. So probably she doesn't like it. But don't go to the alcohol straight away. So how do you like to do that? Anything nicer way to do it?
Can I ask you a question?
I'll tell you that. Yeah, I will tell you how somebody else did that. We are doctors. Doctors, we always keep advising patients. We have a habit of advising patients so many things about health issues. And we always talk about the lifestyle to every patient. Can we talk a little bit about that? Oh, okay, doctor. A lot of people, they have this habit of, the not eating the healthy food. Can I ask you about your diet, please? How is your diet? Do you eat healthy diet at all? Oh, yes, doctor. Fine. I do healthy diet. Oh, that's really good. Keep it up. And what about exercise? Do you do exercise at all? Oh, yes, doctor. I keep going for jogging every day. Oh, that's really good to know. What about smoking? Do you smoke at all? No, doctor. No. Oh, that's really good. Yeah, keep it up. And what about alcohol? Do you drink alcohol at all? No, doctor. No, I don't drink. Okay. Mrs. Sensu, actually, one of our nurse told me that, you have some drinking habits. That's why I'm a bit concerned about your health. So can I ask you, do you drink have a drinking habit at all? No, doctor, no. So, Miss Anderson, what are we going to say? It will remain within our medical team. We're not going to disclose to anyone at all. So do you have a drinking habit? Can we talk about that? No, doctor. What do you do now? Why are you interested in talking about alcohol?
It's not relevant. We don't have time.
Why do you want to talk to her?
She's start having withdrawal.
Because you are concerned about her health. See, we are very concerned about your health. So you are here to help you. Okay, that's the reason I'm asking you if you have any such habits, if it's going to affect your health, it may not be good for you. That's the reason I'm asking you. So can you tell me during, oh yes, doctor. Okay, so then she will admit. So that means, what are the things he will do if the patient is not admitting? First thing is, don't go to the point straight away. Go, go somewhere else and then come to the point. Talk about other lifestyles, then come to that particular point. Okay, so then offer confidentiality, then offer help. So offer the help. Then they might admit.
How did the nurse find it?
Sorry?
How did the nurse find it? She's denying.
You need to worry about that. That's what the question says. We don't need to worry about that. Okay, sir. Now, as I told you,
Is it okay to mention that the nurse found out? It means he started looking at the nurse like, oh, he snitched on me or something like that.
the most important thing in the exam, what you need to do is whatever is there in the question, you need to talk about it. If it's given in the question, you need to talk. So what if she says, alcohol? Who told you about that? What are you going to say? I saw you drink alcohol. Who told you? The point is, you can't simply ask about alcohol. Somebody has told something is there. That's the reason you're talking about it. But the most important, as I told you, the most important thing, whatever is there in the question, you need to talk about it. Every word, what is given in the question. If the question says, nurse told you, you must say that. The nurse told us about it. She found out or she noticed it. And we are concerned about it. Yeah, this is for your own benefit. This is for your own good. We are trying to help you here. Okay, so you need to offer that help. Now, remember, sometimes they don't deny, they will accept straight away. Sometimes they deny. In that case, offer confidence, offer help, everything. And if you read the GMC website again, they usually say you don't need to offer confidentiality. But if you read again, they will say if the patient is denying, and if you strongly believe that patient is having that habit, then you can offer confidentiality. Okay. Now you may have to offer confidentiality for what all? Smoking, usually they don't deny. Alcohol, they may deny, and it happened. There are in the new exam also, she was denying. She kept on saying no, 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 no. Okay, until you talk nicely to her, then only she'll admit. Recreational drugs, sometimes they don't, unless you offer confidentiality and help. They don't usually admit, even in the exam. Okay, then after sexual history, the sexual history also sometimes they deny. So then you may have to offer that confidentiality. Okay, alcohol, I told you what to do. And then the recreational drugs, you can ask, do you use any recreational drugs? If they say yes, what is that? How do you use it? What route? How much? How long? And if he's an IV drug abuser, what is the most important question you should ask? First you ask, do you share needles with others? Do you share needles with others? Okay, the most important question, do you share needles with others? If he says yes, what is the other most important question you would like to ask? Do you know about the needle exchange program? Do you know anything about the needle exchange program? What is needle exchange program? Yeah. Imagine there's a drug addict who shares needle. What he can do, first of all, why do people share needles? Cost, because the cost, to reduce the cost. If you have to the buy new needles every time, it is very expensive. They don't have time. They don't have money for all that. That's why the same needle they use, keep saying they're using the same needle. They exchange the needles also. Okay, so which can transmit infection, which is dangerous. So that's why what the government has done here in this country is they can take the used needle to a pharmacy and give the used needle to the pharmacy, and the pharmacy will give them a new free needle, free of cost, a new needle. Why? That means the government is encouraging the people to be drug addicts. No? Why not?
It's hard to stop the drug habit, so they want them to be somewhat safe.
It's very difficult for drug addicts to stop their habits. And also for the government, which is cheaper, treating a condition or preventing a condition. Prevention is cheaper than treating. So that's the reason anyway these drug addicts, they don't stop using the drugs. At least we can prevent those infections spreading from each other. So that's the reason they have this needle exchange program. So ask the patient, are you aware of the needle exchange program? If he just says no, then explain what it is. He can exchange the used needle and with the pharmacy, and they'll give you free new needles. Okay, so that's a needle exchange program. That's a recreational drugs. Then is the sexual history. Sexual is very, very important. So you should know how to take sexual history. I want one of you to take a sexual history. I'm the patient. I'm Mr. Smith. I'm a 45-year-old man. I'm a 44-year-old man. Who's going to ask sexual history? Who's going to take sexual history? Okay. Let me give a chance to somebody else who never spoke. No, you also spoke somebody who never spoke to me. Who's that? Yes, doctor behind. Yeah. Yes. Take sexual history. Mr. Smith, 45-year-old man.
Directly into sexual history.
Maybe this is a part of some other things here. You'd asked all other things before. Now you come to the sexual history.
Okay. Mr. Smith, are you sexually active?
What do you think, doctor? You don't assume. That's good. It's good that you don't assume. But the thing is, whom do you normally ask, are you sexually active? Young people. Yeah, that's the reason I gave you age, 45. The 45 years, most likely they are sexually active. If it is a 16, 18-year-old boys, girls, all these things, then you'll be starting with, are you sexually active? Because they may not be sexually active. Okay, so that's the reason I give you adult. So 45, around 40. So how do you start?
Mr. Smith, are you sexually active with males, females, or both?
This is even worse. Or animals, yeah. This is how you ask. When I gave an example, I wanted you to start with the decent question. Start with the decent way of asking questions. That's right. Start like that.
I heard somewhere that if you ask if they're married or not, sometimes they get offended. So that is why.
That's why. What is the other thing you can add with the marriage? Partner. Are you married or do you have any partners? Is it a decent way to start? Yes. Start like that.
Okay, Mr. Smith, are you married or do you have any partners?
I'm married, doctor.
You're married. All right. And how long have you been married?
3 years.
3 years. All right. Have you ever had any sexually transmitted infections?
Before marriage. No.
Do you have any other partners?
What about this partner?
If he's married, then most probably he has one.
He has one.
Yeah.
He has one what?
Partner.
One partner. Which partner? That is that particular partner. It doesn't mean that here. Okay, that's why you ask something else. But that's not my question. My question is he and his partner, whoever it is, they're having sex, isn't it?
Yeah.
So what do you want to know about that?
Sexually upset, that's
Are you sexually? Huh?
presently.
Presently, it's like, okay, in the exam, if he says I'm married, there are one more thing, gay marriages are allowed now. But the gay marriages not yet come to the PLAB exam as yet. So, if a man says I'm married, that means he's married to a lady. Okay, for the exam. So the point is, do you want, again, if he says I'm married, that means for the exam's sake, you can assume they're having sex. But in real life, it doesn't mean that if they're married, that they do have a sex. Because they may be separated, they're living separately, or maybe they're living in different countries. So it doesn't always mean they have sex. But for the exam's sake, if they say I'm married, that means he is having sex with his wife. That. Now, what is the most important question you want to ask about he and his wife having sex? Say, do you practice safe sex? Do you practice safe? That is the most important question. What is safe sex? Safe sex. What is safe sex? Okay, let me first you answer this question. What do you mean by safe sex? When I say safe against pregnancy, safe against STI. Not the both. STI. When you say safe means safe against STI, not against pregnancy. You're not talking about the pregnancy here. Now, if you say barrier method is not a safe sex. Barrier method can prevent pregnancy, but the barrier methods is spermicides, not all the barrier, especially for spermicides, also barrier method. Spermicides can prevent pregnancy, but spermicides do not prevent the STI. So if you say barrier method, that's wrong. Last time somebody says single partner is safe sex. Is single partner safe sex? No. Why not? Because he may have one partner, single partner, but that partner may have other 5 partners. So that is not safe either. So what is safe sex? The condom. The condom. Only the condom prevents the STI. So that means when you're asking safe sex, you're asking, do you use condom? Now, in this country, everybody knows what is safe sex. How do they know? They've been taught in the school age. Why do you teach the children about safe sex? Because they can have sex. Imagine they have unprotected sex and they end up with having HIV, hepatitis. That's the reason you need to protect the children. So that's the reason we educate them about the safe sex. That means in this country, everybody knows what is safe sex. That means who does not know what is safe sex? People from outside. For example, overseas doctors, yeah? It's overseas doctors. Doctors come from outside, they don't know what is safe sex. But here, everybody knows what is safe sex. That means if you ask a patient, do you practice safe sex? Actually, you're asking, do you use condom? In this country, everybody knows. Okay, so imagine, yeah, ask me that question. Do you practice it? Ask.
Do you practice safe sex?
Yes.
Okay. Do you use a condom?
What is safe sex? Then why you're asking the question again?
You want to be sure.
I want to be sure. Yeah, 100% sure. Go ahead. Now, he is practicing safe sex with his wife. That is, he's using condom. Can he still get STI from his wife? He's using condom. He's using condom. That's what he said. The point is, imagine if somebody is using condom 99% of the time, but 1% of the time they're not using condom. If you ask them, do you practice safe sex? What do you think their answer will be? Yes, because 99% of the time they are using condom. But to get the STI, how many times they need to have sex? In one is enough to get a STI. So that is not, that means if you simply ask the question, or do you practice safe sex, if they say yes, that is not enough. What will be a next question? Have you ever had any unprotected sex? Have you ever had any unprotected sex? That's a very important question. First, you ask, do you practice safe sex? If they say yes, Don't stop. Next question. Have you ever had any unprotected sex? They may say yes to no, all these things. So now we are talking with husband and wife here actually. You're not finished. One more question you're supposed to ask. What is that? Sorry? STIs or treatment, STI, come to that later. One more. Act of sex. What is the question about act of sex? The root of sex. Which are the roots of sex? Oral, anal, vaginal. How do you ask this question? How do you ask this question?
What sorts of sexual
What?
What sorts of sexual
What sort of sexual intercourse? Last time somebody asked in the mock test, do you prefer front or back? Yeah. This is like you're showing a menu card, yeah, front, back, side, what? Any other day other than vagina? Okay. Last time again, I'll tell you. The last time somebody else asked, do you have abnormal sex? Right or wrong? Why?
It's judgment, discriminatory.
Because whatever you think is normal, it may be abnormal for them. And what you think is abnormal may be normal for them. How do you know? Well, that's wrong. Again, somebody asked, do you practice unconventional sex? Again, whatever is unconventional to you may be conventional to them. This is a wrong way to ask questions. So how do you ask a question? Ask a question directly. There, do you have vaginal, anal, or oral intercourse or sex, whatever it is? Okay, so do you have vaginal, oral, or anal intercourse? But when you ask these questions, what you don't do? Don't laugh. don't smile. You know, don't show any expression on your face. Okay,
Sir,
so
here are we assuming that the patient is already having STD, or we're just taking the history?
you are taking history to find out how it has got STIs. If the patient, when you take a sexual history, when you're thinking the patient may be having STIs, you're trying to find out how they got STI, from where they got STI. That's why you're trying to take history, sexual history.
But if the patient is married and his wife does not have an STI, so wouldn't he feel offended that we are doubting his wife's character or something?
Okay, we are, first of all, we are doctors here.
If they are having unprotected sex, I mean.
First of all, let me finish talking on how to take sexual history. Then you ask me this question. Okay, so what were I saying? The ask about the root, as I told you. Now, root of the sex is the last time somebody asked me the root like this. I was again acting like a patient. He asked me, "Do you have oral sex?" I said no. Then he stopped taking sexual history, went on to something else. Then I had to stop him and I said, "Doctor, stop. Is it the only route to what you know about?" Why? If you want to ask only one route, which you should name it and ask? Anal, not even vaginal. Why? His high risk is anal. The reason you're naming all the three routes is to find out is he having anal sex at all? Because that's a high risk. Okay, so either you ask only one route, which is anal, or you ask all the three routes to find out whether he's having anal sex. Okay, so, but again, in the exam, the root of sex is not that important. You can leave that part. But practicing safe sex, have you ever had an unprotected sex? These are very important. Now, this is about his own partner now. Now we shift on to the other partner. Ask me. Continue taking history now.
The same man, and he's married.
Yeah, he's married. You talk of safe sex. He said yes. Have you ever had an unprotected sex with your partner? No.
And we are suspecting that he might have an STD. Right?
Yeah, because he had the same. That's the reason you're taking history.
All right.
Okay.
Mr. Smith, do you have any other sexual partners?
No. Okay, let me say yes.
All right. Male or female partners, may I know?
Female.
Female partners, all right. And when was the last time you had unprotected intercourse with this female partner?
Okay, listen to the question. When was the last time you had an unprotected sex with this female partner? What does that mean? You assumed that I had unprotected sex. That time you said you don't assume anything. Now why did you assume things now?
Again, my mistake.
Your mistake. Ask me properly.
Okay. And do you have safe sex with this female partner?
Do you practice safe sex? Do you practice safe sex? Yes.
Okay. And are you absolutely certain that you never had unprotected intercourse with this female partner?
Is it the way to ask question? Nice. Have you ever had any unprotected sex at all? Have you ever had unprotected sex at all with this partner? Oh no, doctor. Once 3 weeks ago, we didn't have any condoms. So he may say something. Okay, so now we know how to take sexual history. Yeah. The first about that particular partner, then you move on to the other partner. Finish up with that particular partner first, then move on to the next partner. But again, be careful. Imagine you ask, do you have any other sexual partner? If he said no, does it mean that he did not have sex with anyone else other than his wife? No, because the other person who may had a sex may not be his partner. He just had a one-night sex with somebody, met somebody, or he went to a prostitute. It was not a partner, so you will miss it. So, what is the best way to ask question? Have you ever had any unprotected sex with anyone else other than regular partner anytime? Have you ever had any unprotected sex anytime with anyone else other than your regular partner? That's the best way to ask questions, short and covers everything. Have you ever had any unprotected sex with anyone else anytime other than this regular partner? Now, there are some important things what you need to understand about sexual history and STIs. As for example, imagine we have a patient. Patient is A. Your patient is A. He's a man who's got a urethral discharge. Do you want to take sexual history? Yes. Now here's a regular partner or a wife or partner who is B. Okay, so you ask about the safe sex and all that to the unprotected sex. He said yes, no, whatever it is. Then you ask, do you have any other partner? Did you have sex with anyone else at all? Unprotected sex, anyone else? He said yes. I had unprotected sex with this person C. You had unprotected sex with this person C. What are the important question you should ask now? When? Imagine he said 3 weeks ago. 3 weeks ago, he had an unprotected sex with that person C, who's not his partner, somebody else. What are the important question you should ask now?
Did you have sex with B in between?
Did you had unprotected sex with this partner after that? Is that an important question?
Yes.
Very, very important question. After that incident, did you have unprotected sex with this regular partner after that? You may say yes or no. Now again, the sexual history, of course, should include the symptoms. Has he got symptoms on that particular patient? The reason you're taking sexual history is because he had a symptom. Should you ask symptoms of the partner also? Yes. Now imagine the partner did not have symptoms. Does it exclude STI in the partner? No, sometimes they don't have symptoms. Okay, so just because they don't have symptoms, that does not exclude STI. Okay, so now when you're asking about unprotected sex, if this person had unprotected sex, if you ask him about the regular partner, it does not always mean that the regular partner gave him that STI. He would have got STI from somebody else. In this case, can you see that? It's not the regular partner. So when you're asking symptoms, that's if that person had symptoms, Either she got the STI from him, or maybe somebody else, as is this person. Maybe a person D. You got a signal from there, or the STI from there too. It could be from anywhere. Okay. Your history should include everything possible. Okay, so now there's something called as partner notification. What is partner notification? Imagine this person has got the STI now and has got a regular partner B. Now he had a sex with somebody else, unprotected sex, then he had unprotected sex with partner B. Now she has also got the STI. If you treat only the patient A, who is your patient now, is that enough?
No.
No, because again he will have a sex with the person and he will get an infection again. Not only that, we are responsible as doctors, we are responsible for the health of this person also. So that means this person, his regular partner, also need to be treated. So what do? Call. You tell your patient, can you please tell your partner, to come to our clinic so that we can test your partner and treat if required. Can you please tell your partner? But imagine your patient had sex with a prostitute. Do you think he will tell the partner?
No.
When you tell him, can you please tell your partner, what do you think he will say? Doctor, how can I tell? So I can't tell her. So what do you do? If you don't tell, we will tell. If you can't say that, we can tell you. We can tell your partner. Yeah, anonymously means without revealing your name, without revealing what the reason for. We can just inform your partner, just to tell her that routinely we do tests for a lot of people like that. Can you please come have a test, and if at all anything we can treat you. You're not revealing the reason why you're telling her. Okay, it is not that a must you have to tell her. In which condition you must tell the partner? HIV. If it's HIV, yes, you must tell the partner. If this person did not agree to tell the partner, then as you have a duty to tell the partner, your partner has HIV. But other things, the other STIs, if you're going to worry all that, it's not a must that you have to tell the partner. Because partner, if he has a symptom, they will go and get treated anyway. But HIV, yes, you have to say. But other things, that's the reason your wording has to be right. If you say then, if you don't tell, then we will tell. That's wrong to say. Okay, so if you cannot say, you're reassuring him. If you can't say yourself to your wife, don't worry, we can tell your wife anonymously without revealing a name so that we can treat her also. But first thing is to convince him to tell the partner. How do you convince him? Tell the importance of why we should treat a partner also. Because if you treat only you, that is not enough. Because if you have unprotected sex with the wife, maybe she also has got this infection now. If you have a sex again, probably you'll get the infection back from her. Not only that, it's very important that you need to treat your partner too. So tell him, so hopefully he will get convinced. If he's not, then you tell him about the partner notification. All of you understood what is partner notification now? Okay. All of you know what is needle exchange program? Yes. That's a location of that needle exchange program. Somebody told in the exam, we will do, we have a partner exchange program. Needle exchange, partner exchange. Yeah, you bring your partner here, we have other couple here. Okay, so don't mix up things. Okay, there's one more thing called as contact tracing. What is contact tracing? Imagine the patient. A is your patient. He has got the STI. Now, treating him alone is not enough, because as doctors we are responsible for the health of every person here. So if this person has sex with the person B, maybe that person, we need to call that person and treat that person. And here they had sex with C, you call that person, treat that person. Then maybe C had a sex with D, we call that person, and D had a sex with E, we need to treat that person also. That is contact tracing. They're treating everyone who had a sex. Maybe they're all testing and treating them. But again, don't go into the contact tracing in the club exam. Why? One is not necessary. And also the problem is if you go deep into the contact tracing, you might find out yourself with there in the chain. Contact tracing is not necessary for the exam. Okay, so but partner notification is very, very, very important for the exam. Okay, so don't ever miss the partner, taking history of the partner and partner notification. Very, very important. So now I told you about the sexual history. Yes, what was his question? The online doctor, somebody asked the question that time. What was the question? Somebody asked?
So suppose this person A has not had sex with some other person outside his marriage, but he got it from his wife, who had sex with someone else.
Okay.
Now, do we disclose it? I mean, what do we say that time?
Good, fine. Now there is a question in the exam. There's a lady who had the symptoms. There's a lady who had the vaginal discharge. Should you take sexual history? Should you take sexual history? Yes. She said, I had this partner. I had this partner for the last 3 weeks. This is a new relationship. And I had an unprotected sex with him. So, and she asked, did he give it to me? Did he give that? Yeah, you told her this is STI. STI means sexual transmission, somebody has given it to her. So she asked, did he give it to me? I had unprotected sex with this man who started a relationship 3 weeks ago. What do you answer? We should.
I should ask her.
Well, he has got symptoms. He has got symptoms. Did he give it to me?
I should ask her at the beginning. Have you ever had unprotected sex with somebody else?
Yes. That means.
I have to determine.
That means, yeah. So imagine this is the partner B is a lady. Yeah, he has one partner 3 weeks ago, started relationship. He has got a symptom. She also got a symptom. If she asks, has he given it to me? You don't say definitely yes. No, we do not know. First of all, you should have taken history whether she has got some else. Maybe she had the partner see somebody else, or So that means you should take history. Did you have any other partners at all? Maybe when she is in the 3 weeks, when she had a relationship, maybe she has got 2 men at the same time. She's seeing 2 men at the same time. Or maybe she had a relationship before this man, before the 3 weeks. So you need to ask, did you have any other sexual partners at all? Okay, so sometime here, 6 months ago, I had this partner, blah, blah, blah. Then what do you tell? Our question is, did he get this infection? Well, it's very difficult to say from where you got it. It could be from anyone. You're not pointing to this person. This person gave it. That is not a doctor's duty. Because sometimes it's happened that, it was a husband-wife. The wife asks, did my husband give it to me? Will you say yes? No, we don't know. We don't know that. But the important thing is that we need to treat both of you. As a doctor, that's our job. Our job is not to say how you got it. Okay, so that is, you don't go into that part. Because sometimes they will insist, did he give it? Did he give it? You say, I'm sorry, we do not know. But imagine, this is a lady, she had only this partner. Only this partner, no other partner at all. And she's got symptom, he's got symptom. And she asked, did he give it to me?
I can't say.
You still say, I do not know. We don't know that. And you need to know, especially symptom, the vaginal discharge, if they have, it's not always STI, sexual transmitted. Sometimes it could be the IUDs. When you insert IUDs, they can have these infections. So that question is also very important. History is also very important. In the exam, she had an IUD. So if you had an IUD, what do you tell her? Well, infection can be due to other things also. It may not be always sexually transmitted. It could be from insertion of the IUDs. So it could be from anywhere. We do not know. So don't ever tell the patient that this person gave it, that person gave it to you. Okay, that is not our job. Our job is to we are only concerned with the health of the people and treating them. So how they feel about it, that is not our job. whatever they feel is something to them, because we are interested in treating them.
So I have two questions, please. Okay, sorry to draw us back. I just wanted to ask for the